My name is ILSE TREURNICHT, and it is a really great pleasure to welcome you to this third in the series on innovations in mental health, co-hosted by Mars and our terrific partner, CAMH. We started the first session on innovations in mental health focused on children, and so it seems entirely appropriate that we will do this third in the series tonight, focusing on mental health challenges for seniors.
There's a forgotten population. It's those individuals who are aging with a history of complex mental illness, things like schizophrenia or severe depression.
As I grow older, the depression does not go away, but other things come into the picture. Physical illnesses, various kinds of ailments that I never had before. And one thing I have learned about depression is that I'll never be free of it.
I'll paint for you an example of one of my patients that I have in one of my groups. So Marianne is 67 years old, and she's prototypical of the average patient. So she's living alone. She's got a diagnosis of schizophrenia dating to her mid-20s. Although she's living in a rooming house, the sheer task of how to cook, how to get her groceries from the grocery store, remembering what's on the list, and just getting through her everyday life is a challenge for her. So what can we do for her to help her get through not only her illness, but the process of aging with this illness?
When someone is depressed, the brain circuits aren't working properly. And so one way to change how the brain is functioning is through a medication. The medications affect the whole body, they affect all areas of the brain. With brain stimulation, we're more focal. We're targeting areas of the brain that aren't functioning properly. And I kind of liken it to exercise. So by stimulating the brain, by causing changes in the electrical circuits, we're causing the brain to become stronger, better able to resist the depression. And by repeatedly stimulating the brain, we make it strong enough so that the depression goes away.
People who've had depression any time in their lifetime, they are at a higher risk of developing Alzheimer's disease later on. So that's why we call them high-risk population. And what we're trying to do at this point is try to identify those individuals after they recover from depression and try to see if we can improve their memory, but also trying to see if we can prevent the onset of Alzheimer's disease or dementia long-term using such brain stimulation intervention. If our intervention is successful among this high-risk population, it's possible to think that this intervention could be helpful for the general population, because all of us in some sense are at risk of developing memory problems.
Psychiatry is growing in terms of knowing about how to deal with older patients, which seems to be the case. That seems to be all over the map at CAMH, that older patients are being treated better and being treated more sensitively than they ever have been before in the long history of psychiatric care.